Your PSA came back higher than last year. Your doctor says, we need to keep watching this. You nod. You leave. You go home and search online for what it means. Sound familiar? That was him. Age 64, PSA 6.8, 3 years of monitoring, 3 years of leaving appointments without asking a single question. Then his son, a physician's assistant, came with him to his fourth appointment. His son asked 7 questions in 20 minutes that his father had never thought to ask in 3 years. After the appointment, walking to the car, his father said, "Why didn't my doctor ever tell me any of that?" His son said, "He probably assumed you knew to ask. Most doctors answer the questions in front of them. They don't always volunteer what isn't asked." His father said, "So for 3 years, I've been monitored without understanding what we're actually monitoring for." His son said, "Now you do, and next time you walk in prepared." The 7 questions his son asked that day changed everything about how his father understood his own PSA monitoring. They are not complicated questions. They are not confrontational. They are the questions every man over 60 with elevated PSA deserves to ask, and almost nobody does. Today, I'm sharing all 7, with exactly how to phrase each one. So you walk into your next appointment the way his son walked in, prepared, informed, in control of your own health conversation. Before we continue, quick reminder, this is educational information only, not medical advice. These questions are designed to help you have a better conversation with your doctor, not to replace their guidance. And if you want a free printable version of all 7 questions, ready to bring to your next appointment, drop the word questions in the comments right now. Now, all 7, starting with the one his son asked first. Question 1. What is my PSA trend, not just today's number? His son's first question stopped the appointment in its tracks. He asked the doctor, "Can you show us the PSA trend over the past 3 years? Not just today's number?" His father had never seen his own PSA history laid out as a trend. He had heard numbers at each appointment. He had never seen them together. The doctor pulled up the chart. 6.1, 6.4, 6.5, 6.8. His son said, "So it's rising, but slowly. Less than 1 point over 3 years. Doctor, correct. That is a very different picture than a PSA that jumps 2 points in 1 year. PSA velocity, the rate of change over time, predicts cancer risk more accurately than any single reading. Research from Johns Hopkins found that PSA rising more than 0.75 points per year carries significantly different implications than PSA rising slowly over multiple years. A man who hears PSA 6.8 and walks out without seeing his trend has half the information he needs. A man who sees 6.1, 6.4, 6.5, 6.8 over 3 years has a completely different and far more reassuring picture. How to phrase this question: can you show me my complete PSA history and tell me how fast it has been rising? What does that rate of change mean for my situation specifically? Question 2. What is my PSA density? His son's second question: do you have his prostate volume on record? And what does that make his PSA density? The doctor checked. Prostate volume from a previous ultrasound, 68 grams. His son calculated on his phone. PSA 6.8 divided by volume 68. PSA density 0.10. Doctor, that is reassuring. Below 0.15 is generally considered lower concern territory. His father said, "I have never heard the words PSA density before today. PSA density adjusts your PSA number for the actual size of your prostate. A large prostate naturally produces more PSA. A man with an 80-gram prostate and PSA 8 carries very different risk than a man with a 25-gram prostate and PSA 8. The raw number without prostate size context is an incomplete picture." A 2022 study in the Journal of Urology found PSA density was more accurate than PSA alone in identifying men who needed further investigation among those with PSA between 4 and 10. How to phrase this question? Do you have my prostate volume on record? Can we calculate my PSA density? And what does that number tell you about my situation? Question 3. What is my free PSA ratio? His son's third question. Has he had a free PSA test? And what does his ratio show? The doctor checked. Free PSA ratio on file, 23%. His son explained to his father, free PSA ratio above 25% is generally reassuring. Above 20% is still relatively favorable. Below 10% raises more concern. Doctor, at 23%, his estimated probability of clinically significant cancer from PSA alone is around 15 to 20%. Not zero, but considerably lower than the raw number might suggest. Total PSA includes both PSA bound to proteins and PSA circulating freely in the blood. Cancer tends to produce more bound PSA. A higher free PSA ratio suggests a benign source, like prostate enlargement, is more likely driving the elevation. Most men with elevated PSA have never been told their free PSA ratio or what it means for their actual cancer probability. How to phrase this question? Has my free PSA been tested? What is my free PSA ratio? And how does that change how you interpret my total PSA number? Question 4. What would actually trigger a biopsy recommendation? His father had spent 3 years quietly terrified that each appointment might end with a biopsy recommendation. He had never once asked what would actually trigger that recommendation. His son asked directly, what specific change in his numbers or exam would lead you to recommend a biopsy? The doctor was specific. PSA rising more than 1 point in a single year. Free PSA ratio dropping below 10%. Prostate exam finding a firm nodule. PSA density crossing above 0.15, combined with other concerning factors. His father said afterward, for 3 years, I assumed every appointment might be the one. Now I know exactly what I am watching for. Knowing the specific trigger points transforms monitoring from a source of ongoing anxiety into a structured plan with clear decision criteria. Vague monitoring creates fear. Specific monitoring creates clarity. How to phrase this question? What specific changes in my PSA, exam findings, or other markers would lead you to recommend a biopsy? I want to understand exactly what we are watching for and what would need to change before that becomes the next step. Question 5. Should we consider MRI before any biopsy decision? His son's fifth question was the one that surprised the doctor most. He asked, if biopsy ever becomes the recommendation, would you consider MRI first to guide it? The doctor paused, then said, that is exactly the right question. And yes, for someone his age with his PSA density and free PSA ratio, MRI-guided biopsy would absolutely be my preference over standard random biopsy. The American Urological Association now recommends MRI before biopsy in many men with elevated PSA. MRI identifies specific suspicious areas. Targeted biopsy then samples exactly those locations, detecting more clinically significant cancers while avoiding unnecessary sampling of insignificant tissue. The Precision trial published in the New England Journal of Medicine found MRI-targeted biopsy detected 38% more clinically significant cancers than standard biopsy, while performing significantly fewer biopsies of insignificant findings. Most men don't know to ask this. Many receive biopsy recommendations without any MRI discussion. How to phrase this question? If we reach the point of considering biopsy, would you recommend MRI first to guide it? What does the current evidence say about MRI targeted versus standard biopsy for someone with my specific numbers? Question 6. What lifestyle factors might be affecting my PSA? His son's sixth question shifted the entire conversation. He asked, are there lifestyle or dietary factors that research links to PSA inflammation that his father should know about? The doctor said, honestly, this is something I rarely have time to cover in a standard appointment, but yes, There is meaningful research on diet, inflammation, and PSA elevation that is independent of cancer risk. He outlined 3 areas: refined carbohydrate and sugar intake driving IGF-1 elevation and prostate cell proliferation, chronic sleep deprivation raising systemic inflammatory markers, including C-reactive protein, sedentary behavior independently associated with higher PSA from prostate tissue inflammation. His father said, "Nobody has mentioned any of this in 3 years of appointments. Doctor, it genuinely does not fit in a 12-minute appointment focused on a number, but it matters for the complete picture and for what you can actively do between appointments." How to phrase this question: are there lifestyle factors, diet, exercise, sleep, or anything else that research suggests may be contributing to PSA elevation from inflammation? What changes might support healthier PSA levels alongside medical monitoring? Question 7. What is our long-term monitoring plan? His son's final question was the simplest, and the one his father said made the biggest difference. He asked, "What exactly is the monitoring plan going forward? How often do we test? What are we specifically looking for at each appointment? And at what point do we say the situation has changed?" The doctor laid it out clearly for the first time. PSA test every 4 months for the next year, given the slow upward trend. Repeat free PSA at the next test. Prostate exam at each visit. Reassess MRI discussion if PSA rises more than 0.5 points at any single test. His father said, "That is the first time in 3 years I have heard an actual plan, not just a follow-up date. Monitoring without a defined plan is just waiting. A defined plan with specific intervals, specific markers, and specific decision points gives you something to track and something to hold on to between appointments." How to phrase this question: what is our specific monitoring plan going forward? How often do we test? What are we watching for at each appointment? And what would need to change before we reassess our approach? Imagine walking into your next PSA appointment with these 7 questions printed and in your hand. Your doctor sees the list, sits back, gives you more than 12 minutes. You leave that appointment knowing your PSA trend, your PSA density, your free PSA ratio, the exact triggers for biopsy consideration, whether MRI should come first, what lifestyle changes may help, and a specific monitoring plan with clear decision points. That is a completely different experience than hearing a number, nodding, and going home to search online at midnight. His father had 3 years of monitoring without understanding what was being monitored. One appointment with 7 prepared questions changed everything. You now have those same 7 questions. Walk in prepared. Ask every one of them. Leave with the complete picture. Share this with one man over 60 who has been hearing his PSA number for years and has never once been told what it actually means in context. And drop questions in the comments for the free printable version. All 7 questions formatted and ready to bring to your next appointment.